All right, my name is Jennifer Pierre. I'm a nurse practitioner student for Maryville University. I'm going to be doing my advanced abdominal assessment today, and this is my patient. This is my ID here. You see it?
Mm-hmm.
Okay, that's my ID, and we're just going to do a quick 360 of the room first. Thank you. All right, so we're gonna continue with our advanced abdominal assessment here. And like I said, this is the patient that is volunteering. The first thing I'm gonna do is assess we're just gonna keep the shirt down just for demonstration purposes and for the patient's privacy right now. But the first thing I'm gonna do is inspection of the abdomen, and I'm inspecting for symmetry. I'm going to inspect for any pulsations or any, if the shirt was up, any venous pattern and any peristaltic activity there in the abdomen. The next thing I'm going to have the patient do is lift your head up a little bit off of the bed, just your head, okay? And then I'm just going to look at the abdomen and make sure you can put your head down, make sure that there was no protrusions or anything which would be indicative of a hernia, and then looking at the rectus abdominis muscles to make sure that they're not separating in any abnormal way. The next thing I'm going to do is to auscultate. Okay, so it's going to be a little different because you don't want to, than other assessments, because you don't want to disturb the abdomen before you do other things. So we're going to auscultate first. And I'm going to do all 4 quadrants. The right lower quadrant, and just listening for bowel sounds, which should be about 3 to 5 minutes apart. Okay. All right. The next thing that I'm going to auscultate is the abdominal aorta, and that should be right midline above the umbilicus. To the left a little bit of the umbilicus, and here I'm checking for any bruits. Any bruits that I hear would be abnormal, so I don't want to hear any of that. Bruits would be indicative of aortic aneurysm, and I did not hear any bruits when auscultating there. The next thing that I'm going to do is percussion. Okay, so I'm going to percuss all 4 quadrants first of the abdomen, and that should be all tympani. Okay, so I percuss those, and the next thing that I'm going to percuss is I'm going to check for the liver span on the right hand side. Okay, and that's going to be your midclavicular region, and I'm going to start at an area of tympani, and for demonstration purposes, I'm going to use tape here to mark my upper border and my lower border and measure from there. The normal liver span should be between 6 and 12 centimeters. Okay, so I'm just going to percuss here. Okay, and then I'm going to still be at the midclavicular region, but I'm going to start down here, the area of tympani, and go up until I hear dullness. We're going to just do a quick measurement of that. Okay, and that is about 8.5 centimeters. Okay, so that's within normal limits for the liver span. All right, the next thing I'm going to percuss is going to be this the splenic area. I'm just going to have you move your arm out a little bit. The splenic area is going to be on the left hand side. It's going to be in the trough space, the mid-axillary region at the 6th rib. Okay, and that's the trough space here. Okay, and you want to make sure that that is an area of tympani. You shouldn't hear dullness. If you do hear dullness in that area, then that would be a sign of liver enlargement. Okay, the next thing that I'm going to percuss is the gastric bubble, and that should be right below, to the left side, below that rib. in the epigastric region on the left. And it should, wow, good tympani, an area of great tympani there. So he definitely has tympani there in that area. So the next thing that I'm going to do after the gastric, checking for that gastric bubble, I'm going to do some light palpation. And with light palpation, I'm checking for any masses. I don't want to go more than 1 centimeter in depth, okay? And then I'm going to make sure I'm assessing my patient to make sure that there's no areas of tenderness or anything. Something that I would have to investigate further. So I did that light palpation. The next thing I'm going to do is deep palpation. And that's going a little bit deeper, probably like 5 to 6 centimeters in. And again, I'm checking for any masses, any areas of tenderness for the deep palpation. The next thing I'm going to do is check for the lower liver border. I'm going to bring my left hand over to the around to the 11th and 12th rib, and I'm going to bring my hand up here. I'm going to ask you to take a couple of deep breaths, okay? Nice deep breaths, and then out, and then the next one I want you to hold it. Okay, and it's just to see. I'm going to bring my hand up to see if I can feel that lower liver border. You can breathe normally. Okay, and I didn't feel that lower liver border, which is normal. It's not normal to feel the lower liver border. If you do feel it, it should be nice and smooth, and it might be indicative of liver enlargement too, so that's something that we would have to investigate further as well. Okay, the next thing I'm going to feel for is at that lower liver border. I'm going to feel the right side for that gallbladder. Okay, with deep palpation, I'm going to ask you to take a couple of deep breaths again. Okay, and then I'm going to ask you to take a deep breath and hold it. Okay, I don't feel the gallbladder, and the patient is also, you can relax and breathe. The patient is also not tender or grimacing or anything like that, which is good. If the patient were to grimace or would cause a lot of pain, then that would possibly be a sign of cholecystitis, something that I would have to investigate further. The next thing I'm going to palpate is the spleen, and that's going to be at the costovertebral angle here, and I'm just going to lift up a little bit down here and then palpate that. And the spleen should not be palpable. Obviously a palpable spleen would be a sign that the spleen is enlarged. Okay, so the next thing that I'm going to palpate would be the abdominal for any aortic pulsations, and that's going to be, excuse me, to the left of the above the umbilicus, to the left a little bit. And we don't want to feel any pulsations because that could be indicative of narrowing of the aorta, inside the aorta, and aortic aneurysm. I'm also going to palpate around the umbilical ring here. Okay, and I'm checking for masses and herniation or any granulation or anything like that. Obviously, if the shirt was up and the skin was exposed, it could, give me a little bit better of a view there. The next thing I'm going to do is check the kidneys. I'm going to bring my hand over to the left, the right flank area, and push in. And it's not normal to feel the kidneys either. Okay, and I'm going to bring my hand under this flank area, the left. Okay, all right, and I don't feel any of the kidneys or anything, and that's normal. Okay, I'm going to ask you to sit up. Okay, the last thing I'm going to do for my advanced abdominal assessment, I'm going to put my hand here to the flank area, and I'm just going to apply a quick percussion with the ulnar part of my hand, my fist, to check for any tenderness in that area, to make sure that there's no kidney tenderness, which could be a sign of infections or something like that. And you can lay back down. All right, and that's the end of my advanced abdominal assessment.